Question number 5, Keith Brown.
To ask the Scottish Government when it last received an update on NHS Forth Valley's Assurance and Improvement Plan.
Cabinet Secretary.
Thank you, Presiding Officer. The Scottish Government receives regular updates on NHS Forth Valley's Assurance and Improvement Plan through the NHS Forth Valley Assurance Board, which last met on Friday the 8th of March. Good progress has been made across all areas of leadership, culture and governance, and with a strong focus of evidencing the improvements that are now being made. I'm hopeful and confident that this will lead to de-escalation. Minutes from the NHS Forth Valley Assurance Board meetings are published and can be viewed on the gov.scot website, and a copy of the improvement plan is available on NHS Forth Valley's website.
Keith Brown.
Can I thank the Cabinet Secretary for his answer, and I acknowledge that progress is being made and that Forth Valley Hospital performs well in areas such as elective care. And for my part, as a local MSP, I continue to get a steady stream of very positive messages about the care that people are receiving, and I think we should acknowledge the work of the staff in relation to that. But the Cabinet Secretary will be aware of the challenges faced by the smaller health boards like Forth Valley, and can he outline any further measures that the Scottish Government is taking to address this?
Cabinet Secretary.
Thank Keith Brown for that question and his interest, and also for the information that he's been able to pass on there in terms of direct patient experience, which I think is incredibly important. This is indeed a challenging time for us all. I recognise, as Keith Brown has, that the progress that's been made in elective care, the continued difficulties that there are in areas in unscheduled care, for instance, and indeed those challenges being faced on a wider basis by other smaller boards. The Government is continuing close dialogue with boards to maximise performance and delivery locally. This is supported by strategic collaboration on financial and workforce planning. Practical measures from an NHS Scotland perspective include mobilising tailored improvement support from the National Centre for Sustainable Delivery, creating additional capacity through the new national treatment centres, and targeting both regional and national approaches where appropriate to support pressurised services. But I recognise in Forth Valley's case improvements have been made. There is more to do, and I'm committed to providing as much support as I can in order to see that continue to happen.